Good evening, ladies and gentlemen. Thank you very much for this invitation, Dr. Ariel Odriozola, and the organizing group of this meeting. I'm Helena Schmid, and I'm from Brazil. I have no conflict of interest related to this talk. For more than 20 years, the International Working Group of the Diabetic Food presented evidence-based guidelines on the prevention and management of diabetic foot disease. And almost always risk factors are related to inferior limb disease. In 2021, CRES and collaborators, as well as other authors, are presenting reviews about some new risk factors. If these new risk factors are confirmed, they could change future guidelines. As this audience already knows, randomized clinical essays in diabetic foot are rare. Then, how to prevent the emergence of diabetic ulcers? We think that appropriate prevention measures matching the risks involved are probably effective. In diabetes, PPN is a trigger for foot ulceration. And the classical main risk factors described by CRES et al. as also by the IVGF are diabetes, neuropathy, arterial disease and its sequela, and aging. Other risk factors are now being described by CRES. And the first one is obesity with BMI over 35 kilograms per square meter. So if we think about this as having important role in prevention of diabetic neuropathy and ulceration, we have to think that this is a risk factor that could be changed. So in the Danish arm of the study addition from Denmark, risk factor trajectories preceding diabetic polyneuropathy were searched. The study was a case-controlled study with 452 people, and the authors found associations with diabetic polyneuropathy for higher baseline levels of A1C, increase in A1C over time, and higher baseline levels of weight, waist circumference, and BMI. And they concluded that obesity was a risk factor for diabetic polyneuropathy. In a systematic review about physical activity and dietary interventions in diabetic neuropathy, these authors presented a review of 14 human studies and 6 mice model studies. They are all small studies. It was impossible to make a meta-analysis, but they tell that there is emerging evidence that lifestyle interventions are effective in individuals with established DPN. The authors conclude that data from randomized controlled trials is needed. An elegant study was made from the group of the University of Michigan about peripheral neuropathy in 4,002 participants from China. In this study, they showed the prevalence of PPN increased with worsening glycemic status. Diabetes and body weight were significantly associated with PPN. Then the question that comes, is PPN prevalence high in subjects with severe obesity and without diabetes? We and other authors had the opportunity to study this population. So we looked for the prevalence of PPN in severe obese patients with metabolic syndrome, but without diabetes. And it was a cross-sectional study, and we used the Michigan Neuropatia screening instrument and found an 11% prevalence of PPN. On Poisson regression analysis, low HDL cholesterol was independently associated with PPN. Our group also studied severe obese women, also without diabetes, for prevalence of PPN and associated factors. It was a cross-sectional study with 450 women, and what we show was that PPN was highly prevalent. In multivariate analysis, postmenopausal status and age were independently associated with PPN. The other question that came was PPN progression is modified after interventions for treating obesity. And in 2018, we found that publication in Obesity Surgery of a systematic review and meta-analysis of the effect of bariatric surgery on peripheral polyneuropathy. 4 studies were included in that analysis. And they measured the neuropathy by using Neuropathy Disability Score, NDS. And what was shown was that NDS significantly decreased in patients having more than 6 months of a bariatric surgery. So bariatric surgery had a positive effect on PPN. Our group also had the opportunity to study the prevalence of PPN before and after the bariatric surgery. And what was shown was in that cross-sectional study was that before the bariatric surgery, the PPN prevalence was 20.4%, and after the surgery it was 10.5%. And it was significantly different. And our conclusion was that PPN prevalence is lower after the bariatric surgery. And it's occurred for both gastric bypass and sleeve gastrectomy without difference between them. In a longitudinal study, we saw that after the bariatric surgery, PPN scores decreased. This was presented in the last Diet meeting, and it was a a study where the participants had diabetes or no, but all of them were severe obese persons. So if we look to the table that Dr. Kress presented in his paper, we can see that there are lots of papers about the body mass index changing and amelioration of neuropathy, as well as prevalence of high numbers of neuropathy when this body mass index is high. So we think that probably in severe obesity with or without diabetes, loss of weight could prevent or ameliorate the polyneuropathy and its complications. Then there is a challenge to all health professionals, actually two challenges: to follow up people with obesity and diabetes for PPN, and control the risk factors for PPN in this population. Thank you very much for your attention. And I also would like to say thank you very much to Dr. Otto Nienhoff, Dr. Lisiane Dias, and especially Dr. Fernanda Dapper Machado. And also to the team of the Center of Obesity of Santa Casa de Porto Alegre. Thank you very much.